All right. Welcome, welcome, everybody. I have 11 o'clock my time, so that means it's noon your time. And you should be able to see the PowerPoint on your screen, the full slides. A little bit of housekeeping. We have a full hour for you today, all about Count the Kicks and how to implement it into your practice, workflow, protocol. We have a lot of people that registered for this webinar, so I'm super pumped about that. So people will probably be logging in as they can. So I'm just going to go ahead and get started because we have such limited time today. I'm super excited. In a little bit, we'll introduce all of our presenters. There's 4 of us today, and I'm so glad you're here. A little bit housekeeping. Right now, if you could, go ahead and type in the chat box just where your organization, like what organization you represent and where you're at in Ohio. I think that's really awesome to know who's on our webinar training today, and then it also makes sure that you can hear me. And so you are all muted as you enter. So if you do need something, you're gonna have to use the chat box and let us know. I have Heather Johnson-Welver, who is a panelist, and Jasmine. And so they can all check the chat box too and kind of signal me if we need to stop or do anything like that because we have so many people. I will be turning off my video for the majority of the presentation just to help with broadband and videos and things like that, but I'll turn it back on towards the end so we can have a conversation if you have any questions. And with that, I'm going to go ahead and stop my video. I want to figure that out. Okay, and we're going to go ahead and get started. So first, I just want to thank the Ohio Department of Health for allowing us to have this presentation today. It is with our partnership with ODH that we are able to bring this training to you for free, as well as the Count the Kicks materials for free. So everything I talk about today is because of ODH and allowing us to bring you this awesome stillbirth prevention campaign. And I would like to invite Melissa, my contact at ODH, to just say a few words for you all today. You there, Melissa?
Still muted, Melissa.
She's a phone number. I know sometimes there's some, there you go. I think this is you. There you go, Melissa. Let me know if you're unmute. You can unmute now. There. Did you get it?
Perfect. Yep. Good afternoon. My name is Melissa Kuhn from Infant Vitality at the Ohio Department of Health. On behalf of the Ohio Department of Health Bureau of Maternal, Child, and Family Health, we are excited to partner with Count the Kicks in providing today's webinar. Through our partnership, we're able to provide you with stillbirth prevention education and resources with the goal of decreasing Ohio stillbirths. Thank you for attending, and thank you for all the work you're doing to help Ohio moms and babies. I'll now turn it over to Megan for today's presentation.
Awesome. Thanks so much, Melissa. All right. So our presenters today, well, Melissa was one of them, but these are the women I wanted to introduce you to, and I will ask them in a moment to give them, give you a brief background on themselves. But first, obviously, I'm Megan. You can see me there. You have my contact information. Feel free to reach out to me or to Melissa if you have questions after this. I'm more than happy to talk to you about any of this. This truly is my passion. My background is I used to work for Iowa Department of Public Health in tobacco prevention and control. And we are based in Iowa. And I did that for several years. And I used to work for a nonprofit. And I basically did prevention, tobacco prevention for close to 11 years. And towards the last couple of years, I started having kids myself. And I just really got interested in maternal and child health. And I really focused on cessation around pregnant women and not smoking while pregnant. I managed the state Quitline program. And so through all of that work and experience with my own children and using Count the Kicks, I was just so excited to see a position open up at the organization. And so I have been with the organization for about 20 months. So it's been about 1.5 years. And I am the director of programs. And so what that means is basically I do a lot of the programming, a lot of the outreach. So I do a lot of these webinars. I work with all of our state partners. We have 11 states that we work with, and I just love having these types of conversations. I love sharing this information with you all. And I'm also really, really passionate about systems change. So you'll probably hear me talk a little bit about that later and how you can truly incorporate this into your program of work. And with that, I will go ahead and let Jasmine introduce herself.
This is where that mute button gets me every time. Okay. Hi, my name is Jasmine Abraham. I am the Cleveland ambassador for Count the Kicks. I became an ambassador because in June of last year, we lost our son Gossam to stillbirth at 37 weeks. One of the main reasons that I joined the Count the Kicks was because my provider, when I asked her if I should count the kicks, she said, no, as long as baby is okay, as long as he's active, that he should be just fine. And even at my postpartum appointment, she kind of doubled down and still said, you know, counting the kicks doesn't help prevent stillbirth. And I really do believe that she's wrong. And so my goal is to help the providers in Cleveland to spread the word about Count the Kicks and try to get as many of these offices resources as possible.
Great. Thank you so much for sharing that, Jasmine. And then Heather.
Hi, I'm Heather Johnston Welliver, and I live in Westerville outside of Columbus, Ohio. I am the mother of 4 children, and my second child, Lydia, she would be 6, but she was stillborn in November 2014 after 34 weeks of a perfectly healthy pregnancy. I had no risk factors. In fact, like I said, she was my second child. And she was actually my most active baby out of all of my pregnancies. To honor her and to keep her an active part of my life, I dove right into stillbirth prevention. I worked for 5 years with Star Legacy Foundation, and now I'm working with Count the Kicks. And I'll be able to talk a little bit later about kind of how some of my nonprofit fundraising work can benefit you, because we can offer free CEs to all our healthcare providers as well through Liddy's Loop, which is a nonprofit fundraiser we put on. But I've also had 2 rainbow babies, so I have a total of 4 children. And during their pregnancy, I obsessively monitored every kick, jab, and roll, and firmly believe in counting kicks. Lydia was stillborn due to a cord accident, a constriction in her cord. But like I said, she was kind of my most active baby until she wasn't. But my doctor had never suggested I monitor her movement, had always just kind of said, hey, lots of movement. And we all know that's not a real gauge of that. So I'm happy to be able to make a difference in my daughter's name and be here with you guys today.
Great. Thank you, Heather and Jasmine. And I will just say that I am so happy and proud that you are here today and that you are being brave and sharing your stories in honor of your children. And I hope everybody listening today knows that Jasmine and Heather are here for you to help share this message in Ohio and to get more moms to understand Count the Kicks and use the app. And so we're excited to be here today to present this to you. And with that, I always like to start this presentation with a really great feel-good story. Baby Ruby was saved by her mom. She's from Iowa. And what's really cool about this story and why I like to share it is 2 things. One, it really shows you that how that mom to mom, that storytelling, how that is so important. I think one of the things you'll remember from today is Heather and Jasmine's story, right? So I think that showing this and that mom to mom storytelling is so important. And then I also want to share that social media, that push, all of that education is really important too, because what happened with baby Ruby is she got picked up on Good Morning America, the Today Show. And after that, she was on Good Morning America, we saw like a 1,300 increase in our app downloads. And we have had such a tremendous, and this was in 2017. And so we have had such a tremendous effect on people's lives before that. And even since then, we get around 3,000 to 4,000 app downloads every month. We are downloaded in 140 countries and we have over 125,000 downloads. So here's a story. It gives you a good idea of what Count the Kicks is and how that storytelling really plays a role in our messaging.
We're going to turn now to that GMA parenting alert about a free app. A mother says helped save her baby's life by tracking how often she kicked. ABC's Diane Macedo is here with that story. What is this all about?
So this mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off. Well, it turns out her baby was in real trouble.
For Emily and Jeremy Ecoff and 2-year-old Liam,
oh, nice.
life with their new baby Ruby is extra precious.
We have a healthy baby girl, and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the 3rd trimester.
It's just one of a growing number of apps helping parents through pregnancy and labor. For the Ecoffs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did, and when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden, they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
She sleeps about 23 hours a day.
4 weeks later, Ruby is now home, healthy, and sleeping like a baby.
Doesn't get much cuter than that. Now, the app was made in Iowa, which is where that family is from, but the creators say it's now spreading nationwide, thanks in part to Ruby. Since the news of her birth, the app has gained more than 5,000 new subscribers. So, Robin, the app saved Ruby, and by raising awareness, she may end up saving many more.
Yeah, I just worry because I think it also gives you a good idea of how the app works, right? And we'll go into that a little bit more detail. So again, within weeks after we appeared on Good Morning America, 2 more babies were saved. And that reporter said it at the very end of that video where she said, and her mom saving Ruby, she also will go on to save potential babies. And with you all getting this information and sharing it, you have a chance to save babies as well. And so we have a highly effective evidence-based stillbirth prevention campaign. We developed an early warning system for moms, and we are saving 1 in 3 at-risk babies in Iowa. We are ready to go, and we're so excited to be partnered with ODH to bring this to you all. Before we really dive into the implementation of Count the Kicks, I really want to make sure that we all understand the definitions behind stillbirth, miscarriage, and infant mortality, so we all know what we're talking about. So we're talking obviously about stillbirth prevention, and a stillbirth is a loss of a baby after 20 weeks of pregnancy. Stillbirth is also further classified as either early, late, or term. And so you can see those definitions and there's clarifications down below. So an early stillbirth is a fetal death occurring between 20 and 27 completed weeks of pregnancy, and then late is 28 to 36 completed weeks, and then a term stillbirth occurs between 37 or more completed pregnancy weeks. On average, 23,500 babies are born still every year. Close to 24,000 babies are born still every year in the United States. And then when we talk about miscarriage, a miscarriage is usually defined as a loss of a baby before the 20th week of pregnancy. And then there's infant mortality. And this is where I see people get just a little bit confused between thinking infant mortality and stillbirth is the same when it's actually not. Infant mortality is death of an infant before his or her first birthday. I think everybody on this webinar knows all of this, but I think it's really important to highlight because we are losing just as many babies to stillbirth as we are to infant mortality. And yet we're not talking about it like we are infant mortality. And that's not to downplay infant mortality. We have to be talking about that. The Back to Sleep campaign is tremendous, and we should be sharing that. We should be sharing safe sleep practices, not smoking, you know, keeping the fan on, all of those things that can help prevent those infant mortality terrible, terrible situations. But we also need to be talking about stillbirth. And that's why we're here today. We know firsthand, Heather and Jasmine know that this is a very hard subject to talk about. And the reason we want to do this today is because we want to make it so you feel comfortable talking about this, that you know how to talk about this and how to implement Count the Kicks. And so I don't go into too much detail of the causes of stillbirth. If this is something you're really interested in, we have a lot of great research articles on our website, but this is just one study that talks about the likely causes of stillbirth, identified from most common to least common. So things like pregnancy and labor complication, problems with the placenta, birth defects, infections, problems with the umbilical cord, and then medical complications in the mother. But today I really want to focus on the stillbirth prevention because that's what we're all about. And so I want to give a brief history so we understand how this was founded and why it's evidence-based and research-based. So actually in the early 2000s, 5 Iowa moms endured the heartache of losing a daughter to stillbirth or infant death. They didn't know each other at the time of their loss. That you can see the 5 women on the screen there. That is Jan, Janet, Kate, Carrie, and Tiffin. They actually got connected through pastors and friends. And so they kind of formed this group, and they were connecting over conversations. They had connected conversations over coffee, just talking about their grief and going through this together. And what was really interesting through these conversations is they found out that even though they were told by providers that, you know, stillbirth isn't that common, when they started talking, and here they are sitting, 5 Central Iowa women who all experienced this in around the same time frame, they started doing research and realizing that stillbirth is a lot more common than people think. And so what they decided to do is they wanted to channel that grief into stillbirth prevention to help keep other families from facing the pain of losing a baby. In 2004, you can see the blonde there, the second to the right on your screen, that's Janet Peterson. In 2004, she was a state representative, and through her legislative work, she worked along with the other members of the founding team. They worked together with U.S. Senator Tom Harkin. He was a U.S. Senator at the time, and he was also the author, if you remember, of the American Disabilities Act. And so they worked together to get the very first Iowa Stillbirth Registry, the first comprehensive stillbirth data collection program in the country. So working with U.S. Senator Tom Harkin and support from CDC, they did receive some funding from it for the project. And so others heard about the registry and work and began advocating for a national stillbirth registry to allow more data to be collected more quickly. And so it was a couple of years later, around 2007, that a couple of the women were at a conference that was all about stillbirth in the United States. And so at this conference, they heard about a public health research study that had been done in Norway that demonstrated a 30% reduction in stillbirth by teaching pregnant women how to monitor fetal movement during the 3rd trimester of pregnancy by doing kick counts on a daily basis. Several scientific studies, not just Norway, indicate that kick counting, a daily record of babies' movements during the 3rd trimester, is an easy, free, and reliable way to monitor a baby's well-being in addition to regular prenatal visits. And so the women heard this story or this research study. They came back to Iowa and they said, this is it. This is our next project. We are going to do this. Great things start in Iowa. Let's get started. And so, so based off this scientific research, the public awareness campaign, Count the Kicks, was born, pun intended, in 2008. The next year, they created Healthy Birthday, which is the nonprofit organization, because we all know for awesome campaigns like this, we do need a nonprofit to be able to write for grants and things like that. So if you think about it, Healthy Birthday is like the umbrella, that is the nonprofit, and then Count the Kicks is one of the prongs in our hallmark stillbirth prevention educational campaign. And so they worked with Iowa Department of Public Health and a local marketing company to create Count the Kicks as we know it today, where they made, they got some funding from IDPH to make it free for all maternal health providers in Iowa to have their offices stocked with educational Count the Kicks materials, so posters, brochures, and things like that to hand out to every pregnant mom. In the first 5 years of Count the Kicks, the Iowa stillbirth rate decreased nearly 29%. And in the first 10 years, so 2008 to 2018, we've had a 32% reduction in the stillbirth rate. Not only that, but in the first 5 years, we've also seen a dramatic decrease in the stillbirth rate of African-American women in Iowa. We've seen about a 38% decrease of African-American women in Iowa. We'll talk about the data and the disparities coming up, but just so you know, African-American women are 2 times more likely to experience a stillbirth over white women. And so we really put a laser focus on that, and we really wanna make sure that we are reaching and centering women of color in this campaign as well. And so going back in 2015, we created the free app that you know about today, and that's what we'll talk about. And then it wasn't actually until 2017 that the first executive director is hired, and that's who you saw spoke on that video, Emily Price. She is still our executive director today. So we are a small and mighty team. There are 5 of us now that actually work at Healthy Birthday, and then we have all these awesome ambassadors that help keep the momentum going in all these states and things like that. And so what we want to do is keep this going in all of these partner states so that you can bring what we have done in Iowa to Ohio to save more babies. And so when we look at the data, like I mentioned, 1 in 167 pregnancies ends in stillbirth, and the racial disparities are large. For Black women, it's 1 in 96. For Hispanic moms, it's 1 in 191. And then for white women, it's 1 in 204. Families are 10 times more likely to lose a baby to stillbirth than to SIDS. For Ohio, and I got this information from ODH, we have the 2019 rate. Stillbirth data is about a year behind. So we just got this data, which is awesome that we got it already. So 2019 rate for Ohio was 6.3 per 1,000 live births. It was 6.6 in 2018. So we've already seen a slight decrease, which is amazing. This is because of all this great work that we have already been doing with ODH to get this information out to you all. The white non-Hispanic rate for 2019 was 5.4. For Hispanic, it's 6.2. And then Black non-Hispanic in 2019 was 10. And then I put a little tab there because I wanted to highlight that in 2018, the Black non-Hispanic rate was 11.2. So you can see that we've slightly gone down from 2018 to 2019. So that's exciting. We want to keep that momentum going. Some additional Ohio resources that I really wanted to make sure you all knew, and I should have said this at the beginning, but you will get a recording of this and you will get these slides. So you will have all this information. But they have a lot of great resources at ODH. So there's this infant and fetal mortality link and infant mortality related programs. So feel free to check those out at your leisure and really immerse yourself in all these great data and research and projects that ODH is doing. And so really quickly, now that we know about national data and your Ohio data, just to kind of share a little bit more about the Iowa stillbirth data, you can see there we are the teal bar, and then the United States is the average, and we don't have 2019 just yet. So like I said, it's kind of state by state and just varies. But in 2018, we were at our lowest Iowa stillbirth rate on record and lowest in the US at 3.9. But still, Iowa families are still losing an average of 174 babies to stillbirth every year. And while our rates are far better, we still lose 1 baby for every 109 pregnant Black women, while for white women, it's 1 per 250. So you're probably thinking, why are there such large disparities? And I think it's really important that even though this is something that you might already know, we need to continue to talk about it, and we really need to shine a light on it because these disparities are so large. We need to narrow that down, and we want to get to a place where race is no longer a predictor of stillbirth. And so this is what researchers have pointed to some of the following causes of these disparities. Systemic racism, the toxic stress. Research shows that years of being treated unequally and or unfairly, essentially being an African-American woman in a systemically unjust society and everything that comes with it, has led to real and pervasive health issues for Black women. Those epigenetics, those years and years of generational racism has literally caused changes in the DNA sequence. And then those predispositions to certain conditions that might lead to stillbirth, like gestational diabetes, preeclampsia, high blood pressure, all linked to maternal stress. Experts say Black women are less likely than other races to receive early treatment for these conditions. This is why things we talk about too, where representation matters, right? So getting more women of color and individuals of color in the healthcare system. So we just wanted to note that we have reviewed research articles, and these are the points from various articles. We'd be happy to share more with you if you're interested. The access to healthcare, and then research shows education is not a determining factor. A college-educated Black woman is still more likely to lose her baby than a high school-educated white woman. So we know there are large gaps among racial disparities in stillbirth, and we have made it a priority to focus on this issue. We have done a variety of different things to shine a light on this issue and hopefully decrease the number of stillbirths among these individuals. We're continually looking for funding opportunities to to reduce racial disparities that persist in stillbirth. Through past and current funding opportunities, we have been able to hold focus groups that have really helped, focus groups with women of color, to improve our programming based on their lived experiences. And I'll talk about that in just a moment. But we've also done inclusive organization with the full board and staff training on implicit bias and structural racism. Our entire staff and board is going through this and has gone through it. We have created toolkits specific to the faith community, and we have worked to reach the African American community through these faith-based outreach and beauty salons. Because one of the things we learned about from this focus group that we've done a couple times is women of color, they were saying that two things. One, they were getting their information from a lot of different sources. So it might come from their doctor, or it might come from their mom or grandma or hairstylist. And so with this information, we took that and we created a faith-based toolkit and outreach materials to connect with African-American women in the community. We worked with beauty salons and churches. We trained them on Count the Kicks. We got them posters. And some of the things that we learned in the focus group also shared that they were shocked. These women had no idea that they were at such an increased risk of stillbirth because nobody's talking about it. And they were angry and they said, why? Why is nobody saying this? We need to shout this from the rooftops. And so we need to stop treating women like delicate flowers and share this information with them because it's important. Black women are 2 times more likely to experience a stillbirth. Let's stop that. So this is how we do it. So we put it all out there. We created those toolkits, and that's what we're working on currently. We also have the app in 12 languages, and we have culturally appropriate educational material. So one of the things I really wanted to share, this is a new video that we just got created. Brianne Ward, she is a licensed mental health therapist, and she is a wonderful, wonderful woman that we're working with in Iowa. And we had her create a video for us because we know that patients feel more comfortable and more secure with the physician they can connect with. And that's one of the reasons why representation matters. And we want to make sure that we are trying to get more diversity in healthcare, meaning a more safer, healthier, and stronger communities across the entire United States. So this is something that we created that we will share on social media, and we can share in Ohio, and you guys can take and use if you have videos that can play and things like that. So I'm just going to take a moment and share this video.
Did you know Black women are 2 times more likely to lose their baby in the final weeks of pregnancy than their white neighbor, colleague, or friend? It's true. For Black women, 1 out of every 96 pregnancies will end in stillbirth. As a mom and mental health counselor, these statistics are beyond troubling. They're unacceptable. At Count the Kicks, we've developed a free, evidence-based tool to help you monitor your baby's well-being in the 3rd trimester of pregnancy. The Count the Kicks app is saving lives. Here's why it matters. Studies show babies move less when they aren't doing well. Just like when adults feel sick, we want to lay in the bed or on the couch. It's the same with babies. If they are struggling, their movement changes. A decrease or rapid increase in movement is the earliest and sometimes only indication that there might be an issue with your pregnancy. The Count the Kicks app is a powerful stillbirth prevention resource, allowing moms to have a daily kick counting session to get to know what's normal for their baby. You can even share your kick counting information with your partner or friend. If you notice a change in what's normal for your baby, we encourage you to speak up to your provider. Don't wait. Hospitals are open 24/7, ready to serve you. We want you to have the joyous birth experience you deserve. Download the free Count the Kicks app today.
So what can you do? Centering those most at risk on social media, using those social media posts that we have. We have a CE training. You can do equity audits of your organization like we do, health equity trainings. Really, as a community leader, you have an opportunity to help share this message and change this narrative. Like I said earlier, we are striving toward equity where race is no longer a predictor of stillbirth. And so what does it take to reach equity in birth outcomes? It's partnering with organizations. It's having these conversations. Celebrate One, Cradle Cincinnati, First Year Cleveland, Doulas of Color. One organization in particular, the Celebrate One, I've had a lot of great conversations with. I don't know if they're on the phone today, but Celebrate One has actually taken Count the Kicks messaging and put it on their intake form. They reach, I think, around 2,000 pregnant women a year. And so you can see there right in the middle, after they talk about, are you currently pregnant? Yes or no. It says, have you downloaded the Count the Kicks app? Yes or no. And then it has a nice little paragraph about what Count the Kicks is, why it's important. This is a systems change. This is super easy and cost effective to do, to implement, to start sharing this message with your patients and clients and everything like that. So shout out to Celebrate One. We've had great partnership with them, and we're so excited to bring more of this to organizations in Ohio. And so really briefly, now that you know all about the data and everything like that and the disparities, we really want to talk about research and evidence. I'm just going to kind of skim over this because we have a lot more to get to today. But if you are really interested in research, the two takeaways I want you to know is, one, we have a lot of great articles on our website that you can review. And two, this is truly a research and evidence-based campaign. This is not something that the 5 founders just made up. This is backed in research. And so this quote right here, Dr. Ruth Fritz, she was part of that Norway study that I talked about at the very beginning. And this is a quote she had from the that Norway research study. It says, tracking fetal movement is a non-invasive way for expectant parents to monitor their baby's health in the 3rd trimester. Babies can be saved when expectant parents are educated on getting to know their baby's normal movement patterns starting at 28 weeks and to speak up if they notice a change. So again, we didn't invent kick counting, we invented the tools and resources to help you have this conversation with your patients and clients. And then here's some additional research articles that can be found on our website. And so now the meat of it, the implementation of Count the Kicks, I am going to transition this over to Heather so she can share more about the actual program. Heather.
Thank you, Megan. So as I mentioned before, when I was pregnant with my first and my second children, I did not count kicks. It was never recommended to me. And after my second child died and was stillborn at the end of my pregnancy, I diligently counted kicks for my rainbow babies. And I did use this Count the Kicks app for myself. In the first year it was created actually in 2015. So I'm happy to be able to talk to you about it through personal experience as well. And I just want to talk to you about how we actually use this app. Obviously, it's a stillbirth prevention campaign. And as we mentioned, the simplest way to prevent stillbirth is to monitor the baby's movement. And this is evidence-based, but it's also centered on the mom. It's meant to be an empowering campaign for expectant women. We know stillbirth is a difficult conversation. Unfortunately, Jasmine and I know that probably more than anybody. But this campaign, it's purposely bright and colorful. Because we want it to make it easier to talk about. And we want expectant parents to be able to understand what's normal for their own baby and to speak up and allow them to learn how to advocate for themselves if they notice a change. I often tell pregnant women, you're going to be advocating for your child for the rest of your child's life. My children, my living children are almost 8, 5, and 2, and I advocate for them. So the advocating from the mother needs to start in pregnancy. If you look at our graphics, you'll notice there's a very Dr. Seuss-like feel to them, and that's intentional. The founders even contacted Dr. Seuss's widow because they wanted to make it a bright and colorful campaign to attract attention. So let's talk a little bit about how the app works and what it actually does. So that the hallmark of the whole campaign is this free kick counting app. And that's what I mentioned I used in my pregnancies. This app comes in 12 different languages. You can see them on the screen there. And it is designed so that expectant parents are using the app on their own, but then they can also share kick session results with their provider or others or on social media. They can download the history of their kick counting and they can send it directly to their provider via email or even text. So that the provider is always in contact about the kick counting sessions also. And then it also sends push notifications and daily reminders for the mom to remember it's time for the kick counting session. The idea is that you monitor your baby's movement around the same time every day, so you get to know when your baby is more active. And then so those reminders are really helpful as we all live obviously very busy lives that you get used to doing it at the same time every day. And if you don't pick up your phone to do it, your phone actually sends you a notification. It's time for your kick counting. And then we also survey users to collect data about their experience with the app. So we've had over 3,000 women fill it out so far. And the survey asks questions such like, does the app make you feel less anxious? Does it help you bond with your baby? Did you notice reduced fetal movement? What was the birth outcome? And you can see up here on the slide that this person is counting for twins. There's Snicker and there's Doodle. So you can count for one baby or for two. So actually, if you'll go ahead and take out your own phones right now and go into the App Store, you can actually go into Google Play Store or the Apple Store, search Count the Kicks, and you'll see the app pop out. And we'd really appreciate it if you've actually downloaded the app right now so it's on your own phone. Because when you meet with pregnant mothers, it's much more impactful to show them your phone and hold it out and say, it's totally easy. Look at this. You just tap right here when you get a kick. It's much more impactful to show them that on your phone rather than just mention it. And we want them to go home and do the same thing to download this app themselves. So you can even set up an account and actually make like a fake pregnancy, but you would show them how to do that. And then they just start counting. They literally hit the foot when their baby moves, whether it's a kick or a jab or a roll. And then there's other features on the app like resources, FAQ, there's the baby safe stories. So you can just play with it and become familiar about it, but we'd really appreciate it if you'd all download it now. As I said, it just is so much more meaningful to show that mom to herself, like, this is what it looks like, and this is how you start counting. So how do you use the app? Like I mentioned before, you can count for singles or for twins. And the goal is always for the mom to understand what's normal for her baby. Every baby and every pregnancy is very different. And the idea is that we're encouraging moms to speak up if they notice a change. So that's why providers are here for it. You never believe how many pregnant women I talk to who are like, I don't want to bother, I don't want to bother my doctor or my healthcare provider. And that needs to go away. We need to empower pregnant women to speak up when they notice something different about their baby and to trust their own instincts. They are the baby's only voice. And so we want them to speak up if they notice a change. And we want to tell them either to call them or to go straight to L&D if you notice an issue. And then we need to start to figure out what the change is. So the app is able to show you the average time it takes to get to 10 kicks. So after a few days, there's a chart and the mom will be able to see a graph of the pattern and trend of her own baby's movement. And then what's the change? Every baby and every pregnancy are different. My babies were very active. I think I mentioned Lydia was actually my most active baby. So for my active babies, especially my rainbow pregnancies where I was very diligent about tracking their movements, it usually took less than 10 minutes to get to 10 movements. So if I was counting my baby's kick and it took 45 minutes, I know that's not normal for my baby. And I have that data in that graphs and I can show my provider and I can either call or just head to the hospital to be monitored. We need to remind women that there's no harm in being monitored. With my rainbow pregnancies, my anxiety was very, very high, understandably. And it was normal for me to just not feel good about my kick counts and go have an extra NST and be checked out and feel some relief that someone else was able to have eyes on my baby. And obviously that's a little bit different because that was after a loss, but we need to remind women that they're not troubling anyone if they just want someone else to have eyes on their baby and reassure them. And, 9 times out of 10, things are going to be fine. But in that, that time that it's not, we could save a baby's life. So again, you always have to compare this baby and this pregnancy to this baby and this pregnancy, because Megan's baby might take 35 minutes usually to get to 10 minutes, and that's movements, and that's what's normal for Megan's baby. So we don't compare my baby to Megan's baby. We compare my baby to my baby and what's normal for my own baby. And that's really important. And quite frankly, using the app just helps women become accustomed to noticing the movements. So we do these awesome things like have these graphs and help parents see, but I think it's also parents start to get a sense of what is normal for their baby. They may not have to refer to the app to know that, what is normal and what is not normal. And they might not have to look at a graph, but they can if they want to. And I know for my rainbow pregnancies, when my husband was also very anxious, but, really unable to do much, he loved to look at those graphs because he loved to be able to play a role in tracking those trends for our child. So the app shows the last 5 sessions on a table. You can download the entire Kick session history, and you can send it in email or text at any time to a provider, or share on social media, whatever it may be. You can see on this chart that this baby is taking around 15 minutes every day to get to those 10 movements. So that is the norm for this baby. And then we also have paper charts in case a person doesn't have access to a smart device, or if there's, internet issues. You can always have these paper charts so that you're continuing to do Kick counts even if the phone app isn't working. And Megan's going to show you now a quick video showing you how the app functions.
Thanks, Heather. Yeah, so this is just a video I took on my phone, and if you're already downloading it and messing up, I won't go through all of this because it's 6 minutes, but you can see I'm just tapping the footprint because I am starting my Kick session, right? And you can see on top there, the timer starts automatically. And so every time I feel a movement, I'm going to hit the little foot. So now what I did is I hit how it works there at the bottom, and this is giving me the directions of how and why to use the app. And so every time, the first time somebody logs in, this is called what we call a carousel. They have got to go through these couple slides to start it, just the one time, but then they can always access it by clicking that how it works function there. And so you can see, I'm just going to continue kicking. I go out of it for a second because we introduced this continue Kick session. So we'll pick up where it left off because we know we're busy. Let's say a toddler comes up and is like, I gotta go potty, mommy, and you gotta take them quick to pee, and you come back out and you can finish your quick Kick session. Preferably you're doing it around where it's like calm and you have the time to focus on baby and things like that, but we get it, life. And so I finished that session. I'm going to click finish session. That's obviously the first session I had done in there. So that's why you only saw the one. So I'm just going to fast forward to a couple more. Okay, here's a good one. So this was me counting for Georgia Baby 1 and 2, or Georgia Baby. And so it says, if you're concerned about baby's movements, call your provider. And this is me sending my information to my provider. So you can just click email data and you can send it to your provider like that. We also have like baby safe stories. We have like FAQ, like Heather talked about, different languages. Here you're in preferences and you can download, the whole app would be in whatever language you choose out of all languages there. And so that's just me counting. I was setting up a reminder. We really encourage setting up reminders because we know, research knows, to count at least daily, preferably around the same time, and it's really important to do that. And so I do have this video. We can share it with you if you'd like to share with your moms and things like that. We won't go through all of it because, like I said, it's 6 minutes and we want to get through more of this. So now that you know about Count the Kicks and the app, how do you implement this into your practice? And we know and understand, like we've mentioned time and time again throughout this presentation, that stillbirth is hard. It is not something anyone wants to talk about, but it's so important that we talk about this. So here are some things you might be thinking when we're having these conversations. Things like, you don't want to scare moms. And I mentioned this earlier. Women are not weak flowers. We are told time and time again all these different risks that we might have during pregnancy. And so stillbirth is another risk that moms deserve to be educated on. Stillbirth just happens. There's nothing we can do. There can be warning signs if moms know what to look for. And then her baby's always active. It's not a concern. I know Heather's mentioned this a couple of times. And so I think it's really important because you'll hear this a lot from moms. Oh, my baby's always active. I don't need to count, but babies are active until they aren't. Cord and placental accidents can be sudden, and moms need to know what's normal so they can notice a change. One thing I also tell moms too is, when I get this from like baby fairs and stuff like that, is it's so nice to take the guesswork out of it, right? So you can say, my baby's always active, but does that mean your baby gets 10 movements in 5 minutes or 15 minutes? So you don't have to remember that because the app does that for you. It just is such a nice tool to use to reiterate what you already know about your baby. She's almost at her due date. This is like an old wives' tale. I hope nobody necessarily thinks this, but the risk of stillbirth actually increases as a mom approaches or exceeds her due date. Now, Heather and I are going to go through some other common misconceptions. You can see right now on the screen, these are misconceptions that we have heard out and about that we wanted to address. You might have heard different ones, but we wanted to address maybe the most common ones together. So here's one: babies move less closer to their due date.
And that is just untrue. Babies do not move less, they do move differently. And you may feel sharp kicking and feel less sharp kicking and more rolling instead. But if you're monitoring your baby's movements at the same time each day, it should still take about the same time to get to 10 movements. This one is unbelievable to me because I hear medical providers say this all the time, that it's normal for babies to move less. And I am friends with a lot of women who have lost their babies. We're in the SAD club where we all find each other. And a lot of them were told this. And when they noted that their baby was moving less, they told themselves, oh, it's okay because. So this is just untrue. And when you start to count kicks and monitor your baby's movements, you notice the movements feel different, but they're not less.
Right. Yep. You would still get the 10 movements in the same amount of time. So here's that active one again. I know we reiterate this, but I think it's really important because I think the majority of you are probably going to hear this a lot. So why don't you talk about this one, Heather?
Yeah. So you do hear a lot from women. Well, my baby's always active, so I don't need to count their kicks. And that's how I felt. And I will tell you that Liddy, out of my 4 pregnancies, was probably my most active baby. And I remember complaining about that to my OB, saying, oh my God, she never gives me a break. She's moving all the time. And her words back to me were, an active baby is a healthy baby. But Liddy was healthy, but her umbilical cord was not. And so she was so active that I actually stopped noticing her movements. It was like I blotted them out because I had a toddler at home and a full-time job, and she was moving so much that I stopped noticing when she stopped moving. And that haunts me to this day. But just because a baby is usually very active, they're active sometimes until the moment they are not. And the kicks still need to be counted every day. And I wish I could go back and change that for myself.
Another myth you might hear is, oh, I can hear baby's heartbeat on a Doppler device, so I don't need to worry about movement. And I know there's a lot of apps out there that you can do this and things like that. And nowadays with the COVID, where prenatal appointments might be getting stretched out, what do we want to share about that one, Heather?
Yeah, so what you need to remember is that a baby's heartbeat does not tell us how healthy they are. It only tells us that the heart is beating right now. And so it could stop beating at any moment. So while pregnant mothers may find the Doppler comforting and say, oh, the heart's beating, everything's fine, it doesn't give us nearly as much information as counting kicks does. It just means the heart is beating right now. And so a change in the baby's heartbeat, it's one of the last things to occur when a baby's in distress. But decreased movement is an early sign that the baby may be in danger. So it does not replace counting kicks. And a lot of times OBs do not recommend having a Doppler at home because it can give women a false sense of security.
Right. Yep. Unless you're medically trained, they should not be using a Doppler. So baby's just getting ready for birth and running out of room. This seems like something my grandma would say.
Right. And babies should continue to move up to enduring birth. Again, that kind of relates to the first one, but they may move differently, but they don't move less. And the movements should still be counted at about the same amount of time.
Right. And then probably one of the most recent ones and most common ones is mom should get 10 kicks in 2 hours.
So this is actually just been debunked. It's not true. It's a common misconception, though. When we think of counting kicks, people often think, oh, as long as you get to 10 kicks in 2 hours, you're fine. I actually have a friend whose baby was moving less than normal, and she called her doctor to tell her doctor that. And her doctor said, did you get to 10 kicks within 2 hours? And she said yes, because she did. But like I said before, she did not get to the 10 kicks in the typical 10 minutes that it would have taken her baby. Her baby died later that night because her doctor was focused on that 10 and 2. And so we need to know that that is outdated research. Research now says that if a mom should be focusing on the fetal movement and the patterns of her own baby and her own baby's pattern, there is no we're not looking at a certain number of hours and a certain number of kicks. We're looking at the baby's pattern, that own baby.
Yeah, exactly. And so we do have a research study on that on our website if you're interested in more about that. But basically, kind of Heather's friend's experience was basically what the research study said is when you put a time limit on it, it gives moms that time where it's like, okay, I did get it. You know, normally I get it in 15 minutes, the 10 movements, but today I got it in an hour and 45 minutes. So baby's fine because I got it within 2 hours, but that's not that baby's normal. And so, like I said, there's a research study if you'd like to learn more about it and where that came from. But that's something why we're really trying to focus on letting moms know and understand what's normal for their baby. So when do you talk about count the kicks? 26 weeks of high risk, 28 weeks otherwise. You can use childbirth ed classes, preparing for birth. We have a lot of great, some lesson plans on our website. So if you do teach any of those, you could download those and use those, or you could just take them as your own guidance when you're talking to moms. And how do you do it? Asking questions like, do you know the importance of tracking your baby's movements? Let's talk about how to track your baby's movements. Again, share how movements are jabs, rolls, pushes, anything but hiccups. Hiccups are involuntary, so those don't count. And then of course, share the app. And then remember, stress the importance of knowing baby's normal movement and speaking up if there's a change. Make sure mom knows, especially if you're not mom's primary caregiver or OB or midwife or doula, make sure mom knows where to call if she has a concern. Send the brochure home. Because of our great partnership with ODH, all the material is free for you. So go online. I'll say this multiple times after this webinar. I hope to see all these emails with all these orders because you are filling up your stuff to get this out into the hands of your moms. Share with mom that research shows that evening is usually the best time to count baby's movements, but I wouldn't get too hung up on that. We want to pick a time that mom can get comfortable and focus on baby around the same time every day. And then it goes back to that empowering. So tell mom that providers should be asking about baby movement at every single appointment in the 3rd trimester. Saying things like, tell me about your baby's movement. How is tracking your baby's movement going? Can you show me your count the kicks graph? And if provider's not doing that, let mom know. She has every right to say, hey, I want to talk about this. I want to show you this app that I'm using and this program. What do you know about it? And have them ask and have them put it back on the provider. You know, I remember going to my provider and being told just by a nurse where she's just like, oh, at 20 weeks, have you felt baby move yet? And that's the only time that I have been talked about movement. And so we just want to change that narrative and, you know, make sure that people are talking about this, whether it's the mom bringing it up or the provider bringing it up. And then, so one question we get asked a lot, I did a presentation to a FEMUR group was, what about talking to moms who have had a stillbirth previously about fetal movement? And one of the things that we did was we actually reached out to a lot of our ambassadors, like Heather, that has experienced a stillbirth and a rainbow baby. And so we took all that information and everything, you know, we could find online and got this. And this is what we got from that. So Heather, would you like to share this slide?
Yes. So I think first of all, this isn't here, but recognize that this mom is going to be very anxious. I've never met a woman pregnant after a loss who isn't very anxious about the pregnancy. When I was interviewing MFM, so basically maternal fetal medicine doctors, high-risk doctors, knowing that I wanted to try to have another baby after my daughter's stillbirth, one doctor said to me, well, you're going to be anxious. He said, he actually had 7 children, and he said, I have 7 children and one of them almost drowned in a swimming pool. And I've never not been anxious around water since. And I said to him, well, imagine then your child did drown in the swimming pool and now you're living in a swimming pool for the next 9 months. And that's a mother's anxiety while pregnant after loss. So I would say first and foremost, acknowledge that this woman is not trying again, because trying again is insinuating that our baby was a mistake or an error. And they are not mistakes and errors. They are part of our families and very important part of our families. And this is another child and a sibling. So that's not even on there. That's personal experience and a very pet peeve of mine when I was pregnant after my loss. And people would say, oh, I'm so glad you're trying again. And I said, yes, I am pregnant with my 3rd. And so that language is just so important to acknowledge the child's place in the family, and how hard it is to be pregnant after your baby has suddenly died. And so, recognizing anxiety and then just even saying, what can I do to help? I know you're going to be anxious. You're going to be anxious. What can I do to help that anxiety? My own doctor saw me every single week and never once put a Doppler to my stomach, because that is how we found out my baby died. And instead she gave me an ultrasound every single week. That's not going to help every mom. Every mom is different, but following the same protocol, and knowing our risks are actually higher. So not only do we have the anxiety of, we're pregnant again after a risk, but data shows that we are more likely to have another stillbirth. And we know that. And most women probably are going to be tracking babies' movements probably earlier than 26 weeks even. And sometimes when it's not even recommended to do so, just because we're so anxious. But talking to them about, have you had someone talk to you about how the importance of fetal movement? And that's a very sensitive thing, because we're also always feeling guilt. So what I did tell my doctor, she said, well, why do you feel guilty? And I said, I'm not saying this was my fault, and I'm not saying I chose this, but I am her mother. And as a mother, it was my job to take care of my child, just like it is my job to take care of every one of my children. And I failed at that. And so recognizing anxiety and the guilt, and sometimes talking about counting kicks, is actually very hard, because maybe they didn't do it last time. And they're always going to have to live with that. It's really important, your language matters. So talking about the previous stillbirth and acknowledging the child and using the child name. Please don't use words like fetus or fetal demise. That is so insulting to us. Don't call my baby it, call her her. And I think it's just open for conversation. Sorry, I went on and on there, and there's so many things, but I think recognizing where we are, make sure people in the office read the chart, and are aware, is really, really important. And then sometimes women even like to have like a plan for when they're delivering, to recognize this is a rainbow baby and something very hard and very sacred in a way too.
Mm-hmm. Thank you for sharing that.
If you want to go to the next slide, Megan, I went on and on there, I know.
No, that's perfect. I think that was awesome. So yeah, if you and Jasmine want to talk about SOARS, because this is a great
okay.
Now. Yeah.
So the Ohio SOARS project purpose, what's really amazing and awful is that a lot of times stillbirth wasn't really tracked. There's not a lot of data on it. We don't get birth certificates because our children never took a breath. We don't get social security numbers. We don't get to claim them on our taxes. And so we're moving along in the right direction. And one of the ways we're moving along in the right direction is the Ohio Study of Associated with Stillbirth, which is named Ohio SOARS. And I was part of this committee that put together the questionnaire, but it's a statewide population-based survey designed. It's sent home with women who had a stillbirth, and it's designed to collect information on maternal experiences and behaviors before, during, and after the pregnancy. And the whole idea is to give us more research and data about why this happens. And hopefully when we understand more about why it happens, we can lead to more prevention efforts. And so my daughter would be 6. I was, instead of receiving the survey, I was part of the committee that put it together, but I'm going to let Jasmine talk about it a little bit, because her loss is more recent and she actually received the survey.
Hi. Yeah. So Heather is absolutely right. My son was my first. And so not knowing, being a first-time mom, being pregnant, having the rose-colored glasses on, it's a completely different experience when you leave the hospital completely empty-handed. And so 2 months after our stillbirth, we came back up. I had my son in Dayton because that's where my family is. And we came back up to Cleveland, and I saw that there was a letter from Ohio SOARS warning me that there was going to be a survey coming, which I really appreciated because it gave me the mental capacity to prepare for this. And once I did get the survey, I reached out to Dr. Rena Orza Frank and wanted to clarify my answers to some of the questions. And I wasn't able to answer some of the questions correctly because when I was admitted into the hospital after we found out that our son lost his heartbeat, I falsely tested positive for COVID-19 with the rapid that was administered to me. So my husband and I were isolated from everyone. Our family didn't get to meet our son. And because of that, we didn't get a lot of the services the hospital will typically provide: a social worker coming in, a religious figure, a photographer that would come in and take photos of us. And so after I spilled my heart out to Dr. Orza Frank as Oza Frank as quickly as possible, she had to pause and take a minute because she got emotional. And I don't know about the rest of the lost moms, but you know, as a lost mom, you typically try to train yourself on how to tell your story as emotionless as possible in order to keep other people comfortable. And so it's one of those things that I was very deeply moved by this committee. And she then asked me if I would like to join the advisory committee. And when I joined that meeting last year is when I got to meet Megan. And that is how I've ended up here on your screen today, was through that survey and then reaching out to Count the Kicks to become a ambassador. And so the SOARS program is so incredibly important. The questions that they ask were completely valid. And I can only hope that it would ever help to prevent any other stillbirth. Any lost mom will tell you that they don't want to meet anybody new in this club, but they do. And it's one of those things where, you know, as much as we can help give them the information in hopes to talk to the lost moms after their postpartum appointment and tell them about the survey, tell them to fill it out, tell them to provide the information so that we can try to understand why this is happening. I mean, our son was completely healthy the entire pregnancy. There's no reason that, you know, I shouldn't have been told to count kicks, that I shouldn't have been told to take the survey to get the support that I needed. And then, so the survey is incredibly important, and Dr. Oza Frank is heading up this team, and we would greatly appreciate if you help spread the word about this research project. We've created a flyer that practitioners and support groups working with women and families who have experienced loss can use to communicate about the project. So for more information, please reach out to Dr. Oza Frank at the Ohio Department of Health, and we can provide her number at another time.
Yeah, thanks, Jasmine. And I believe we'll send the flyer out to you all. So everybody that registered will get this recording, will get this, and they'll get that flyer too. So, so that will be sent to you via email.
All right, so we have thrown a lot of information at you guys, and I just want to quickly provide a quick flow of how to implement Count the Kicks into whatever setting you guys work in, whether it's an OB office, a community-based organization, whatever it may be, but all the steps are the same. So first, we want you to become familiar with the Count the Kicks app. Congrats, you guys are doing that right now. Order free materials that we talk about, that we're going to be talking about in a moment. And if you are able to review the additional materials on our website, we even have a sample childbirth educator lesson plans that you guys can use that Megan discussed earlier. And I'm sure that there are people in your office that aren't here today, and we will share this recording and CE trainings with them to make sure that everyone in your office knows about the Count the Kicks, and you can even designate someone in your office to be in charge of ordering materials. You can even reach out to any of the ambassadors for us to help you order materials. You can integrate this into your documentation similar to what Celebrate One has done, and it can be very easily added to notes about patients' charts to remind the medical team that it's time to talk about fetal movements and counting the kicks.
Great. Thank you. And yes, I apologize that this has gone over just a little bit, but we have so much great information. So I'm just going to wrap it up here. And so labor and delivery triage, if we have anybody working in labor and delivery here on the call today, one of the things that you can do is really, I want to know, what's your current protocol when someone presents with reduced fetal movement? How is the entire staff trained on how to handle this? And the same with front office desk for clinics and things like that. You know, what is your protocol? Those are some things that we want to work on and work with you on to integrate into your system. And so making sure things like ensuring Count the Kicks information is on the discharge papers, that every mom that comes in with reduced fetal movement is sent home after tests and should be given the literature. We have some really great examples that we could share with you. And then just some additional notes, stressing to parents to trust their instinct. If mom feels concerned or that if something isn't right, to call the doctor. And I really want to note too that research shows this does not, tracking fetal movement does not cause additional anxiety. In fact, research shows that this can help moms with their anxiety. And we are doing a research study right now with the app and our app users and hypothesizing, and I can't share too much about it because the manuscript's not out yet, but really what we're finding is that, you know, the majority of our users, like 97% from this finished survey, felt less anxious with using the app. So just think about that if you're concerned about that, because that won't happen. Reviewing those common myths and discussing that plan of action, especially if you have a lot of rural moms, you know, if they're like 60 miles from a birthing center or things like that. And we obviously would be remiss if we didn't talk about COVID-19 quickly. We have actually created a lot of great resources providing factual evidence-based information on COVID-19 and pregnancy. And we really feel like we are that early warning system for moms. So we don't have a bunch of moms just flocking to hospitals and things like that, that they are truly educated and knowledgeable on their baby, on their baby's movements, and in tune with that. We have an Count the Kicks Academy for providers, for community-based organizations, and for parents. Go onto our website and check those out. They are just suites of educational videos, guides, resources, everything you could ever want in like a one-stop shop around this, and it's completely free for you. The other free resources, like I said, after this webinar, I hope to see my email box, because we get the notifications of orders full, because you are all running to the internet and going counttthekicks.org and typing in and clicking on order materials. You can get promo posters in English and Spanish. That's what you see on the screen there. You can get how-to posters in English and Spanish, brochures, app reminder cards, super easy. ODH has made this partnership so wonderful. Just go online, click on order materials, click on your state, and fill your shopping cart. Heather. Oh, did we lose Heather?
I'm not sure.
Heather, you can feel free to jump in, Heather. I'll start talking, but we also have a continuing education course, and we are so very excited because Liddy's Loop, Steps Against Stillbirth, that is Heather's fundraiser that she talked about earlier, and through the funds that she raised, you can access this training for free. So use the code SAVEBABIES-OH for Ohio and check that out for free. And I will send the link and the code with you to an email so you can do that. So just thank you to Heather and her family for Liddy's Loop and Steps Against Stillbirth, because that is brought to you for free. And just really briefly, we're going to wrap it up here with our ambassadors, because they are another great resource. As you saw today, we are super pumped. We now have 38 ambassadors in 29 states. And Ohio is very, very lucky, because Ohio has 4. You have 4 ambassadors that can help you with a variety of things when it comes to Count the Kicks. So I think Heather's internet might have cut out, but Jasmine, would you like to share a little bit more about what you can do, especially when COVID's over?
Yeah, absolutely. So Count the Kicks has ambassadors in many states across the US, and these women are passionate about what we're talking about due to their own personal experience. Whether a lost mom or a saved mom, we're all extremely passionate about what we do. And we have attended a variety of events, such as conferences, baby fairs, media interviews, and we work to grow partnerships with fundraising and more.
Awesome. And Heather's back. Heather, would you like to say anything else?
I would just want to add in something we haven't mentioned the whole time, that this is the only health issue I know that we don't believe, we as a collective society don't empower people with information. I always compare this to, like, it's startling to me that I was never suggested to Count the Kicks. Like, we don't not talk about mammograms because we're afraid women will be scared about breast cancer. So stillbirth has such a stigma attached to it, and Jasmine and I feel that every single day. And one of the ways to help reduce the stigma is by talking about it and empowering women by giving them information. And it's so simple. Like, counting kicks is so simple, and like Megan said, there's so many benefits of it. You know, you get to bond with your baby, and husbands can bond with their baby by looking at graphs, you know, so many different things. But we're happy you're here today. We hope you'll continue learning by doing that CE training, which Liddy's Loop funded, so you don't even have to pay for. And we know that today was right in the middle of the inauguration, so it's a big day for everyone. So share this recording with anyone that didn't make it on today. We just want to continue to spread the word.
Yes, thank you. And here's all their contact information. So we have Deshonda, and we have Heather and Carrie and Jasmine. And so this is so awesome to have all these wonderful, brave, powerful women for Count the Kicks in Ohio. We also have a lot of baby safe stories, and I really, really wanted to mention this one. You guys have an Ohio Baby Save, Magdalena. Her mom actually works for ODH, and she found out about it. Melissa, who you heard earlier, shared Count the Kicks information with everybody within the state, like WIC, health departments, and things like that. And so Magdalena's mom, Chrissy, found out about Count the Kicks through this connection and learned about Count the Kicks, downloaded the app, started counting, and saved her daughter, Magdalena. So if you didn't just get goosebumps, amazing. So her mom says, one day of not counting can mean the difference when saving your baby's life. It is so important to count those kicks daily. I thank God for Magdalena, my little miracle baby. And then from ODH Bureau Chief, Count the Kicks is a powerful tool in helping mothers evaluate and track their baby's movement. We are just so thankful for this partnership, and that is the Baby Save. I'm sure there's more out there and we'd love to hear about it, but just wanted to show really how words matter and these connections matter and these stories matter. So next steps, download the app, practice, make sure you share this information, order the material, take the online CE training that Liddy's Loop is proud to bring to you for free. You can connect with us. We have all the social media, sign up for our newsletter. Here is Melissa's contact information if you have specific questions, or you can always reach out to me too. But we are so happy you're here today. I'm so sorry it went over, but we had so much great information to share with you today. I'm just gonna check. We're gonna stay on for a couple more minutes. If you have questions, feel free. Like I said, you will be getting this recording and the slides and everything we talked about today. So I'm just gonna check the chat. If we've had any questions. If you want to talk, you can raise your hand and I can unmute you because remember I did you all.
Yeah, we can stick around to answer any questions.
Yeah. Thank you for the free materials. Thanks, Sarah. Thanks, ODH. Yay. I'm just going back and seeing all of you answered, you know, where you're from. That's awesome. Lydia says, thank you all so much for sharing your expertise and experiences. And Courtney, your detail around empathy and language is very, very helpful. People need to hear that level of detail. I mean, Heather. Thank you, Lydia. I like your name. Oh, yeah. This is wonderful. Thank you so much. Like Heather said, Jasmine, Heather, and I, and Melissa will be on for a couple more minutes. Feel free to, you know, enjoy the rest of your afternoon, and we'll be in touch. Thank you.
Megan, someone asked about the slide presentation. Is that being emailed out to anyone who registered?
Yep, I will email it out to everybody that's registered. Yep, everybody will get the PDF of the slides and the recording here, which I'm going to pause. And I figure that out.
Thanks for joining us, everyone.
Thank you.